There's no like set in stone guidelines, but you can request an ultrasound from your providers. You can
Wow.
simply walk in and say, I won't.
I did not know that. So what happens if you find out you have fibroids and you decide, or your doctor just says, which, let's do nothing. Let's just leave it alone. What if they are left untreated?
That's actually my pet peeve, and that's why I'm very passionate about all of
Mhm.
this. I feel like there's many gaps in on the patient side and on physician side regarding this topic, because that is the most commonly praised things regarding fibroids is like what you just said. Let's leave it alone and let's see what
Yeah.
happens. And then let's do a hysterectomy. Do you see how like doing nothing leads to a hysterectomy? But what
Yeah.
happens in between from your providers? So at baseline, an ultrasound that is transvaginal is a great option. And
Mhm.
sometimes they may have to also do a pelvic ultrasound where the probe is also on top of your belly, kind of like when you're doing an
Yeah.
ultrasound for a baby.
Mhm.
Depending on what or how large it is, the next step could potentially be an MRI. And that may be because of pre-surgical planning, for example.
Mhm.
And sometimes what patients should understand is when we look at your belly and we see something large, we can't always assume it's a fibroid because it could
Yeah.
also be your ovary. Right? It could be other
Mm.
stuff going on. So it's very easy to say, oh, that's just the large. It may not be. So it behooves us to also take a look with an MRI if you need to.